group this week did kidney stones. What are kidney stones, also known as nephrolithiasis? They are hard deposits that form inside the kidneys, and the hard deposits consist of minerals and salts. Causes and types of kidney stones. Kidney stones don't have a single cause, but they have many factors that may increase your risk of developing kidney stones. Kidney stones form when your urine contains more crystal-forming substances such as calcium, oxalate, or uric acid. There are different types of kidney stones, and knowing the type of kidney stone can help you determine the causes and help reduce the risk of getting more in the future. So the first type are calcium stones, and this is the most common type, and they're usually in the form of calcium oxalate. Oxalate is a substance made daily by the liver. Struvite, these form in response to a urinary tract infection, and these grow quickly and become very large. Uric acid, these form in people who lose too much fluid because of chronic diarrhea or malabsorption. And cystine, these form in people with a hereditary disorder called cystinuria that causes the kidneys to excrete too much of a specific amino acid. Some risk factors. Some people are more at risk for kidney stones than others. Some risk factors include family or personal history. So if you've had a kidney stone in the past or a family member has, you're more at risk to develop them. Dehydration, if you're not drinking enough water, this increases your risk of kidney stones, along with obesity, having a high BMI. Certain diets, such as a high sodium diet, can cause an excess amount of salt in your body, which makes it difficult for your kidneys to process it. Certain medications, such as vitamin C, calcium-based antacids, and laxatives, are all linked to increase the risk of kidney stones, and along with digestive diseases and surgeries. Symptoms and assessments. A kidney stone will not cause any symptoms until it starts moving around in your kidneys or passes into the ureters. When that does happen, you might experience pain while urinating, sharp pain in the lower back or abdomen, which is where your kidneys are located, pain that comes in waves, blood in the urine, and nausea or vomiting. Diagnosis. They will do blood testing. This shows how much calcium or uric acid is in the blood, and it also shows the health of the kidneys. Imaging reveals kidney stones in the urinary tract. Urine testing shows the amount of minerals in the urine. This test is done 2 times over 2 separate days. And then an analysis of past stones. So this consists of urinating through a strainer so that it catches the stones, and then the stones will be sent to a lab to get tested, and then this will help the doctor determine a prevention plan for kidney stones in the future. Treatment. The type of treatment that you will receive for your kidney stones depends on the size of them. They could either be small or large. So for small stones, the doctor will recommend drinking plenty of water. This will help prevent stones from forming, and this will also produce clear urine so you can see the kidney stones. Pain relievers to help with discomfort while passing a kidney stone. Some of the pain relievers include ibuprofen or Aleve. Medical therapy, a specific type of therapy that the doctor will recommend are alpha blockers, which will relax the ureter while passing kidney stones. And then for large kidney stones, they can cause more damage, so the procedures are more invasive. So they use sound waves to break up the stones. This allows for them to pass without causing damage to the urinary tract or causing a rupture. Surgery, this removes large stones in the kidneys by using a small telescope inserted through the back. And then lastly, using a scope to remove the stones. A scope and other tools are used to break up the stones in the bladder. Prognosis and follow-up. This is not life-threatening, and the kidney stones are treatable with little chance of damage to the body. There's a 50% chance that you will pass another kidney stone in the next 5 years. Follow-up, we recommend lifestyle changes, which consist of drinking plenty of water each day, a low-salt diet, and eating calcium-rich foods with caution. Talk to your doctor if you're experiencing any pain or concern, and medication can be taken to prevent certain stones. Some medicine include allopurinol for uric stones and thiazide for calcium stones. And these are our references.